This presentation covers the basics of healthcare policy. Healthcare policy can be defined as the design and implementation of the range of federal and state programs that affect the provision of healthcare services, such as Medicare and Medicaid. Public health agencies counter the threat of infectious diseases or unsafe food and support medical research. But this presentation is going to focus mostly on the Affordable Care Act and the strengths and weaknesses of the U.S. Healthcare system. So let's first talk a little bit about the evolution of healthcare policy. We saw the rise of health insurance in the 1930s, and an insurance-based system like we have today. The employer-based health insurance became popular in the 1950s when the IRS ruled that its cost was tax deductible for business expenses. So when the IRS allowed businesses to deduct health insurance as part of their tax deductible expenses, we saw the rise of employer-based health insurance. Then, of course, we have Medicaid and Medicare, which were created in 1965. So Medicaid covers families below a certain income level, so it's health insurance provided by the federal government for the poor, and Medicare is health insurance for people in the retirement age. So once you retire and you reach a certain age, 65, then you are eligible for Medicare, and that is also funded through federal tax dollars. Now, how do we compare to other advanced democracies? Well, other advanced democracies have a national healthcare system, sometimes called a single-payer system, where the government pays for healthcare costs. Of course, the government pays for healthcare costs through tax dollars collected from citizens. So we are the only advanced liberal democracy that has the kind of healthcare system that we have, as it looks, with employer-based healthcare and a not completely single-payer kind of system. In order to address some of the issues in our healthcare system, the national legislature passed the Affordable Care Act in 2010, and there are a lot of different provisions to the Affordable Care Act, but I'll summarize a few of them here. The Affordable Care Act, also known as Obamacare, expanded Medicaid and the Children's Health Insurance Program, required the individual mandate for uncovered citizens. So one of the issues with our healthcare system is that there aren't healthy people paying into the system to offset the costs of people that are using the care. So in order to incentivize healthy people to maintain insurance, the Affordable Care Act mandated, with a penalty for those who did not get insurance through the insurance marketplace if they don't have employer-based insurance. So everyone was required to be covered. And this was meant to incentivize younger, healthier people to make sure that they are covered with health insurance. This policy also included subsidies for low and moderate income families. Also included offering tax credits to encourage small businesses to offer health insurance, and penalizing businesses with 50 or more employees for not offering health benefits. So, very small businesses that had fewer than 50 employees were still not required to offer health benefits, but incentives were created to make businesses of 50 or more, with 50 or more employees, offer health insurance. One other provision from the Affordable Care Act was allowing kids, quote unquote kids, to stay on health insurance plans of their parents until the age of 26. So if your parents have good health insurance and say you're a college student or whatever, then you can, instead of doing the university insurance, you can stay on your parents until the age of 26, and then you're on your own. There was a lot of court battles, and continue to be a lot of court battles about the Affordable Care Act. The individual mandate was ruled as constitutional by the Supreme Court, which was an issue of this policy that is meant to save money by ensuring that everyone has skin in the game, but then also had constitutional challenges because of people's individual rights and whether they should be able to be forced to purchase a product. So I want to take a few minutes to also discuss the strengths and weaknesses of the U.S. health care system. There's no doubt that by a lot of indicators, we have one of the best healthcare systems in the world. That being said, there are certainly weaknesses compared to other advanced democracies. So some of the strengths: great hospitals. We have world-class hospitals. We have great specialists and lots of them. I have personal experience sending my son to see a lot of really great specialists because my son is deaf, and so he sees an audiologist and a speech therapist and had cochlear implant surgery and, just incredible specialists, incredible doctors, great hospitals, and really cutting-edge medical treatments. So there's no doubt that for those people who have insurance and can afford health care in the United States, we have world-class health care. Some of the issues, though, that need to be addressed are high cost. So we spend more on health care than a lot of other countries, and it costs our citizens a lot out of their paychecks. And if we're talking about programs like Medicaid and Medicare, out of our taxes. So we have very costly health care. We also have employer-based issues. So we have a system that's employer-based. So if you lose your job, you lose access to your health insurance. Now there are programs to extend your health insurance after you lose your job, or you leave jobs. It's called COBRA, but that is extremely expensive because you not only have to pay your portion out of your paycheck, but you also have to pick up your employer's portion out of that they pay. So, it might be $2,000 a month to continue your health insurance after you've left your job, if you want to keep the same insurance you had with your employer. So there are employer-based issues that if you have to move, if you have to change jobs, and your family relies on your health insurance, then that becomes something to consider and definitely creates some issues. There's also a quality issue. So I just got done saying that we have great hospitals, great specialists, and cutting edge treatments and great care, but there's a discrepancy here. So we have excellent care for the people who can afford it, or the people who are lucky enough to have good employment that offers good health insurance, or for people who qualify for government funded health insurance. But there are a number of Americans that don't get quality care. We have, by some measures, lower quality care than other countries, and that's mostly for our poor citizens. And then, of course, there are some issues with getting quality care for veterans, too, which is a related issue. We also have some other healthcare issues. Portability. So, related to that issue of employer-based healthcare, we worry that our healthcare might not carry over to a new employer. So, this was a bigger problem. Portability of your health insurance was a bigger problem before requiring insurance companies to cover pre-existing conditions, also part of the Affordable Care Act. So the pre-existing condition issue, the resolution of requiring insurance companies to cover people with pre-existing conditions actually cuts down on the problem of the portability issue. But if you consider a scenario where you can be denied access to health insurance based on a pre-existing condition, if you have a job, you have insurance, and then you develop a condition, and then you go to switch jobs, and your insurance doesn't come with you because you're switching jobs, and we have an employer-based health system, then prior to insurance companies being required to cover people with pre-existing conditions, you might get to your new employer, try to get health care, and then be denied, or if not denied, then be charged gross amounts in premiums and extra fees because of your pre-existing condition. So there are that portability issue has been cut down, but still we have an issue where if you switch jobs, then access to healthcare can be a problem. There are also issues of patients' rights. So, this involves the ability of patients to sue for being unjustly denied coverage. And then, of course, as mentioned before, rising costs. So, the cost of healthcare has gone up over time, continues to go up. The cost of most things seems to go up over time. But the question is, can we slow the rise of the costs? Are there policies that can slow the rise of costs for health insurance and health coverage? So rising costs continue to be a problem. So coverage for all of Americans and rising costs. And I just want to conclude by saying, think about what else might be an issue. We all either know somebody who has been sick, or we've needed to use our healthcare ourselves, and we've had different experiences with doctors and insurance companies, and I want you to just think about what other kind of healthcare issues we have. I can tell you that from my own experience, health insurance companies create a lot of bureaucracy when it comes to getting services and being approved for certain services. And if you've ever dealt with a health management organization, then you have the in-network, out-of-network problem. You can't just go see whatever doctors you want to see. You might have to travel long distances. You have to get pre-approval. They take a long time to get that pre-approval. There's a lot of paperwork involved. I'm certain that there's a lot of bureaucracy with government healthcare, like the Medicare and Medicaid systems. But I can also tell you, as somebody who has a disabled child, that that there's also a lot of bureaucracy when dealing with private health insurance companies. So there are definitely things that need improved. From my own family experience, we saw amazing specialists. We went to great hospitals. My son has ultimately gotten the care he needs. And at the same time, there were a lot of hoops to jump through and a lot of very costly things along the way. So, and we were extremely lucky that I had good employer-based health insurance. So, anyway, there are a lot of wonderful strengths to the U.S. health system, and then there are some weaknesses that definitely need to be addressed. All right, thank you.